my name's Jody Niven. I'm a regional coordinator for Perth South PHN, which is part of the WA Primary Health Alliance. I'm here today with Learne Durrington, who's the CEO of the WA Primary Health Alliance. How are you today, Learne?
Yeah, great. Thank you very much,
That's great. Learne's here today because she's going to be speaking with us about innovation and answering some really exciting and sometimes a bit challenging questions. So, first question I've got for Learne is, why is innovation important to WAFA?
The simple answer, or the short answer, is if we keep doing more of the same, we're going to see the same outcomes. And WAFA is actually founded on innovation, and I know we all use that word a little bit loosely. It's in everyone's lexicon, innovation. But WAFA was founded on an innovative idea, and here we are today, and that is that, that we believed that we needed to do something different that could start to change the health trajectory for those people for whom their health status is poor and they have limited access to good primary care. So I think all that we're trying to do and seeking to do is to both foster innovation but also model it in the way that we work with others.
Okay, and you've started to answer my second question, which is, so how will WAFA facilitate innovation in WA?
Well, excuse me. I think that innovation in and of itself is in the community and underway in many places. So this is not about us saying we're the only way or the only one. I think there are probably two answers to the question. Firstly is highlight, showcase, make known the great innovations that are underway in primary care today, and there's many of them, and some of them are tiny and some of them are quite large. And secondly, from the PHN's perspective, is to provide the opportunity through our commissioning processes to foster innovation where agencies or organisations and individuals are seeking to do something different, but for whatever reason the enablers haven't been there to help foster that. So through our commissioning process, which is knitting together, bringing together providers in locations and starting to build that opportunity for them to collaborate in a way that creates innovation.
Yep, great. And so thinking about that wider sector, primary health sector and the social care sector, what is your call to them?
My sense is I guess built on my own experience and whereby I've been in the social care sector in my career in the past, and the hardest thing was getting health care for those people that we were working with. Now, why was it hard? We either couldn't navigate it, we couldn't find a front door, we couldn't find a service that was accessible. And we know there are great primary care services that are working with those people who are disadvantaged and may live in transitional accommodation and so forth, so services like Street Doctor. But they are rare, they're not everywhere. And from a social care perspective, if you could also enable people to access healthcare in a way that was right for them, that would make a huge difference to the outcomes that a person may experience. So the social care sector provides a great range of services, probably to the same group of people that we're interested in, in that poor access to service, disadvantaged, there might be backgrounds of poor housing, poor employment opportunities and so forth, all the social determinants. And we know that the social determinants and the postcode impact on people's health and well-being. So effectively the social care sector and the primary care sector have a common shared population that we're seeking to serve, just in different facets. So my call to the social care sector is come up with the great ideas, come up with the innovations whereby they can start to knit together services that involve and engage primary care. Similarly, for primary care to knit together services with the social care sector. We see some of that in the aged care environment, but we don't see it necessarily outside that aged care environment. So my call is, remember we've got the same population group, the same target in terms of the people we're seeking to serve, and the same communities. Let's join it up.
Great. We've got a really great video on Primary Health Exchange by Steve Johnson. In that video, Steve talks about hunches, that innovation is based on a series of hunches that join together. What would be your hunch?
My hunch is that there are significant opportunities in the community with the community social care sector just waiting to be unleashed. And my hunch is that if we do join it up, we'll all walk away with feeling though we actually have made the difference. See the person as a whole person in a whole place and joining up. So my hunch is that place-based social and primary care is the way of the future, and if we join it up, we will see a difference in those communities.
Great, thank you. Thank you so much today for that, Leanne. That was really fantastic. I'd encourage everyone that's watched this video to really join the conversation at Primary Health Exchange. Leanne is listening, and we're really interested to hear the ideas that everyone has. Thank you.